Hey everyone, my name is Manoj Matthew and I'm a body MRI fellow at Stanford University. I will be presenting this month's research blog on GU imaging. I'd like to take this moment to thank all the senior editors for their invaluable help in editing the blog. This group conducted a study to evaluate the inter-observer agreement and the diagnostic performance of the 2019 Bosniak classification system compared to the 2005 version. The retrospective study included 207 patients with cystic renal masses. These masses were evaluated independently by 8 radiologists using both versions of the Bosniak criteria. The kappa value for the inter-observer agreement was higher for the 2019 version, measuring 0.64. There was also similar inter-observer agreement between senior and junior radiologists for the 2019 version. The diagnostic of the 2019 version was better with higher specificity and no significantly different sensitivity. This group conducted a study to determine MRI features that improve the ability to differentiate uterine sarcoma from atypical leiomyomas. MRI features from T2-weighted imaging DWI and ADC maps were used to effectively predict and differentiate between pathologically proven uterine sarcoma and from atypical leiomas. 156 women were retrospectively evaluated, and predictive MRI criteria for malignancy were defined as high DWI signal, ADC less than or equal to 0.905, lymphadenopathy, and peritoneal implants. Authors also found that global or focal area of low T2 signal with low intermediate DWI signal less than the endometrium or lymph nodes correlated well to benign tumors. The authors tested a diagnostic algorithm on an internal training set and 2 external validation sets. The algorithm yielded high sensitivities and specificities in differentiating sarcoma from atypical leiomyoma in the training set and the external validation sets. This group conducted a retrospective multi-institutional study to evaluate if patients with isolated right-sided varicocele on scrotal ultrasound have additional evidence of malignancy in the abdomen and pelvis. Patients with existing cancer diagnosis in the abdomen and pelvis, epididymoorchitis, intertesticular or intrascrotal mass, or prior scrotal surgery were excluded. Diagnosis of varicoceles were confirmed by the radiologist. Among the 210 patients included in the study, there was no underlying malignancy to explain the right-sided varicocele, concluding that adult isolated right varicoceles are highly unlikely to be the only presenting finding of abdominal malignancy, and that the finding of isolated right varicocele does not warrant further imaging of the abdomen and pelvis. This group conducted a study comparing the diagnostic performance of non-con MRA with contrast-enhanced MRA for the evaluation of renal artery stenosis. They assessed 400 renal arteries in 201 patients. They found that non-con MRA underdiagnosed a grade 3 stenosis as grade 2 stenosis in 2 arteries when compared to contrast-enhanced MRA. 72 patients were diagnosed with hemodynamically significant stenosis by both non-con MRA and contrast-enhanced MRA. This group completed a prospective study of 110 patients who underwent multiparametric MRI, followed by targeted fusion and systematic biopsy of the prostate. The MRI studies were interpreted based on the ACORE PIRADS 2.1 criteria. A total of 171 lesions were detected by multiparametric MRI and biopsied, with 33.3% of the lesions having clinically significant prostate cancer. 5.7% of the PIRADS 2, 14.8% of the PIRADS 3, 44.2% of the PIRADS 4, and 80% of the PIRADS 5 lesions had clinically significant prostate cancer. 16 patients had normal parametric MRI findings, with 18.8% having clinically significant prostate cancer. This group conducted a study to determine the efficacy of using quantitative pharmacokinetic parameters and ADC values to differentiate prostatitis from prostate cancer. They conducted a retrospective review of patients with biopsy-proven prostate cancer and prostatitis and compared mean ADC and multiple pharmacokinetic parameters. Of the 138 patients evaluated, 44 had prostatitis with significantly higher extravascular extracellular space volume fraction. There was a 92.7% overall diagnostic accuracy of prostatitis with ADC, reverse volume transfer constant, and time to peak as the most predictive combination. The analysis of the signal intensity time curves showed that the type 3 enhancement curves were not seen in any cases of prostatitis. This group performed a study to determine if ovarian mucinous carcinoma and mucinous borderline tumor could be differentiated based on MRI features. They found that mucinous carcinomas at presentation were usually larger tumors with larger maximum mural nodule diameters. ADC values were also significantly lower in mucinous carcinomas. And the group also found that the number of loculi, honeycomb sign, stained glass appearance, fluid level, thickened septa larger than 5 millimeters, peritoneal dissemination, or T2 hyperintense microcyst were not effective differentiating factors between ovarian mucinous carcinoma and mucinous borderline tumor. This group conducted a prospective case series in 27 patients with 29 enhancing renal masses to determine the ability of gallium-68 PSMA PET-CT for the evaluation of renal masses. The aim of the study was to determine if there's a difference between the SUV values between malignant and benign lesions in the kidneys. 24 of the 29 enhancing renal masses were pathologically confirmed as malignant, and 20 of those lesions had positive PSMA staining. Both median SUV mean and SUV max were higher for malignant renal lesions. The washout coefficient was significantly lower in malignant lesions. Based on the results, the group concluded that PSMA could serve as a promising tracer for the evaluation of renal masses. Thank you for your attention, and I hope to see you next time for the GU Research blog.